Très bien. So we are going to start. Alors, bienvenue à toutes et à tous à ce webinaire organisé par l'Association canadienne des sages-femmes, au cours duquel vous sera présenté un documentaire d'à peu près une trentaine de minutes. Le documentaire Des voix pour le changement, portrait de sages-femmes, offre un regard intime sur la vie de 4 femmes très différentes et très complexes, 2 au Canada et 2 au Soudan du Sud. Nous suivrons ces sages-femmes et verrons comment elles doivent surmonter divers défis personnels et professionnels, tels que des naissances difficiles, l'absence de ressources, la quête perpétuelle du respect de leur pratique professionnelle de sage-femme, etc. Le documentaire de 30 minutes met en vedette Dora Kunda et Susana Ku, 2 sages-femmes volontaires des Nations unies au Soudan du Sud, qui luttent pour sauver la vie des femmes enceintes lors de leur accouchement et celle de leur bébé, dans un pays qui enregistre le plus haut taux de mortalité et morbidité maternelle et néonatale au monde. Au Canada, nous suivons Jenn Nguyen et Susana Ku, qui, elles, offrent leur soutien à des jeunes familles aux prises avec un accouchement difficile. Nous les entendrons nous parler de défense des droits et d'autonomisation. Leurs témoignages jettent de la lumière sur la réalité d'une profession que peu de gens comprennent. Le documentaire des voix pour le changement explore l'engagement profond que les sages-femmes ont envers leur profession, leur clientèle, les autres femmes et leur communauté. Le film a été tourné par les vidéographes Charles Atiki Lomodong au Soudan du Sud et Chloé Ellingson au Canada dans le cadre de la 2e phase du projet Strengthening Midwifery Services in South Sudan. Le principal objectif de ce projet est le renforcement des services de sages-femmes au Soudan du Sud par le biais de l'éducation, de la formation entre pairs et du renforcement des associations des sages-femmes afin de réduire la mortalité maternelle et néonatale tout en fournissant un soutien et des ressources dans le but de donner aux femmes les moyens d'exercer leurs droits en matière de santé reproductive. Le projet est mis en œuvre par le FNUAP en collaboration avec l'Association canadienne des sages-femmes, l'Association des infirmières et sages-femmes du Soudan du Sud, le ministère de la Santé du Soudan du Sud et d'autres parties prenantes du Soudan du Sud. Le projet est financé par les gouvernements du Canada et de la Suède. Alors, sans plus tarder, voici le documentaire. Voici, j'espère que vous avez aimé le visionnement de ce documentaire. Donc, il me fait maintenant plaisir de vous présenter les 4 sages-femmes que vous avez vues à l'écran. Et 3 d'entre elles sont avec nous aujourd'hui. Donc, vous aurez l'opportunité de leur poser des questions. Alors, Susana Ku est d'origine sino-péruvienne. Elle a obtenu son diplôme de sage-femme de l'Université San Martín de Porres à Lima, au Pérou. Et elle a terminé ses études à l'Université Ryerson à Toronto. Elle travaille actuellement comme sage-femme à Sarnia et sa passion pour la santé des femmes a commencé dès son plus jeune âge, une passion qui s'est confirmée et renforcée avec la naissance de son frère cadet. Dora Kunda est une sage-femme qui vit actuellement à Wau, au Soudan du Sud. Elle est devenue sage-femme après avoir vu beaucoup trop de femmes de sa communauté mourir pendant l'accouchement à cause du manque de personnel de santé qualifié dans son pays. Le décès de sa coépouse la touche encore profondément. Après des études en pratique sage-femme au Health Science Institute de Wau, elle a commencé à travailler en tant que volontaire des Nations unies. Ardente défenseuse d'une meilleure santé dans sa communauté, Dora voit la pratique sage-femme comme étant un moyen pour réduire les taux élevés de mortalité maternelle et infantile. Scovia Nalumu a senti le besoin de devenir sage-femme après avoir été témoin de la mort de sa tante et de son bébé au moment de l'accouchement. Croyant pouvoir avoir une influence positive sur la vie des mères et des bébés, elle est allée chercher un diplôme en pratique sage-femme au Health Science Institute de Maridi. Puis, en 2015, elle a commencé à travailler pour l'UNFPA en tant que volontaire des Nations unies. Elle défend activement sa profession et espère qu'un jour, le Soudan du Sud sera un pays où les infrastructures seront meilleures, où il y aura plus de sages-femmes, qu'elles seront mieux formées et que sa profession sera davantage respectée. Jenn Nguyen a grandi en Nouvelle-Écosse, mais elle est déménagée dans le nord de la Colombie-Britannique où elle a fait des études de maîtrise et a obtenu son diplôme en sciences de la santé communautaire. Grâce à la recherche qu'elle a faite dans le cadre de sa thèse, elle a beaucoup appris sur les disparités en santé dans les communautés autochtones rurales et éloignées. Elle a pu mesurer l'ampleur du travail qu'il reste à accomplir afin d'améliorer l'accès à des soins de maternité de qualité pour toutes et tous. Elle a poursuivi ses études et a obtenu son diplôme de sage-femme de l'Université McMaster. Elle travaille depuis 2016 au sein de la communauté des sages-femmes Pomegranate. Son objectif principal est de faire en sorte que les personnes qu'elle assiste se sentent soutenues et capables de faire des choix qui leur conviennent pour elles et pour leur famille. La chatbox au bas de l'écran. D'abord, je suis en train de lire et il y a des félicitations. So I can see that you are congratulated for this documentary. And I see one first question. So the question, and I don't know who would like to answer this, maybe all of you. What was the experience like to be filmed? And how did your clients felt about it? How was your approach to convince them to participate in this documentary?
I could go to first, I guess. So that question actually gives me and us, I guess, the opportunity to really thank our clients, our patients, who really gave us the opportunity to showcase the work that we're doing with them and for them. I can't thank enough, especially to Allison, the person who was actually working with me at that moment, to let me involve all this project in a very vulnerable time for her and her family. So I guess it was a mix of emotions of being filmed and knowing still that you have to, well, you're performing your work, but then you know that you're being filmed. And I was always thinking about, like, I have to be careful that my client is feeling comfortable. So I was always asking her, in this case, are you okay? Do you want us to stop? Do you want the person who is filming to be out of the room? And that's how sometimes the films are not in the house or out of the house. But of course, and I think it speaks to the relationship that we develop with our clients. And we have to be very honest, and we have to give them always the chance to verbalize what they're feeling at that moment. I'm watching at the video now, and it's very emotional. I don't know for you, Jen, but it's been couple years now, and I'm like, oh wow, it like I applaud for the people that actually work on how to edit the film and all that. It was beautifully done. Yeah, so
thank you. Jenn, would you like to add something?
Yeah, sure. I think filming is weird. They're really, they're always trying to get these shots. Chloe was awesome. She followed me for 3 weeks. And I walked to clinic every day. And so Chloe just walked with me for 20 minutes while I ate on the go. And it was a lot of me saying, okay, Chloe, it's just going to be me eating now. And me driving to a home visit and then stopping to eat. And then me eating in the car and me eating in the hospital and me eating a lot because I love to eat. And in terms of client participation, I think the biggest thing that I emphasize is that they were in control at all times, just like with their care. And it's their choice. So at any time they can say no or back out or whatever, and that would be no difference in their care with me. And for my client, MA, whose birth was filmed, there was a piece where she was like, no more. And we were like, cool, bye. And then Chloe just like slept in the hospital for like 2 days, basically, just in case she changed her mind. So our videographers were very dedicated as well. And they didn't want to take my direction of filming more of my dog because I think my dog is so beautiful. And I wanted her to be in the film more, but she made a one cameo. So I was pretty happy about that.
Okay, I think that we've lost the connection with Dora, unfortunately. She was in a while, I think, in South Sudan, and we've lost her. Maybe she can come back. So I see another question here. What do you think are some of the major challenges facing midwives right now?
Now I want to share with you my challenge facing us as a midwife in South Sudan. One, we don't have enough equipped staff to give anesthesia. We midwife can do our part in terms like if there is obstructed labor or prolonged or it want to lead to cesarean section. Those are the things facing us. Also, we don't have qualified doctor like gynecology. The only gynecology we have here is only two with this big hospital. People used to refer from Kwajok, from other state to the same World Teaching Hospital. We have another challenge that we don't have a well-equipped neonatal ward like oxygen machine, resuscitation equipment, those things. Also, we have a poor of knowledge update, like training, workshop for the new updates. So also we have learned a lot of the drugs equipment being used in other country which are not here with us. We are well trained from UNFPA. UNFPA has done his part. Even the CAM also support UNFPA to train so many schools. But the problem, those are the things that's facing us.
Yeah, I can speak from a BC perspective. I mean, we're in the midst of contract negotiations right now. And I know in Ontario that there's been a large, long battle with recognition and pay equity. I think in all our fields, recognition for the work that we do, equal pay is a very important thing. It's our livelihood, and it affects us in the healthcare system and our clients. So, you know, that's definitely one of the large issues that continues to plague us. And then specifically in light of the pandemic, midwives being supported in terms of proper access to PPE, to the same benefits that other healthcare providers are receiving in terms of pandemic pay, things like that. We've had in our community, we've had a huge increase in interest for home birth to stay out of the hospital in the pandemic, and we've answered that call, but with, you know, a big toll in terms of burnout and being able to find locums. And when we get exposed with COVID from a client or in the community, we need to isolate. We don't have sick pay, we don't have time off, we don't have things that other professions have in place. And so the pandemic has really shone a light on the inequities that midwives face in terms of work conditions and pay.
Susana, yeah.
Yeah, I guess globally though, midwives have been always struggling with their space in the health system. And there must be different factors around it. It could be because we can hypothesize, like because we are a predominantly female profession, we're taking care of female bodies. But I think at the end of the day, it comes from recognizing that pregnancy, birth, postpartum is as important as checking someone's heart or detecting cancer or so many things, because it's an event in someone's life that you really bring family together or you separate them. And then if we're talking about a global perspective, just because because I've been trained outside Canada, I could speak on how many times, actually right now, my colleagues in Peru are struggling very badly because there is this fight against taking away all the recognition that they have gained through so many years, like 194 years of working, because that's how their profession is regulated. And by the conversations with our peers in South Sudan too, it seems to be the equal amount of disparities, the equal amount of trying to silence the voices of midwives and the people that are being served by midwives. Hopefully we will have a right answer to tackle with that concern and problem. But I echo Jenn, like, I think it's exhausting just been fighting many years with the health system, with the society, and we are quietly been working behind the scenes during pandemic. And then the biggest advocates for us have been actually our clients. I don't know how it was for you, Jenn, in your province, but when we were lacking PPE, it was our clients who were donating PPE to us because we were in the list of healthcare providers. And then it wasn't until maybe the third wave, at least here in Ontario, that they decided, okay, we need people, so let's call midwives to fill up those gaps. But in the first wave or so, we were silent. And I could speak, I think it was the same in big parts of the world.
Okay, great, thanks. So there's I think we're gonna just take one more last question here, and it has to do with the peer-to-peer experience. I think that both of you have participated to this peer-to-peer component in the part of the project in South Sudan. Could any of you explain what it was exactly and what kind of experience you gained through that component, through that participation? You were twinned with a midwife in South Sudan, but can you explain to us how it worked and what kind of experience you gained through that?
Yeah, so Jenn and I were part of this group of Canadian midwife pairing with midwives in South Sudan. The first call of enrollment, they were calling new registered midwives or midwives that were working in Canadian capacity within, I think it was the first 3 years of their training, right? And then we were pairing with newly graduated midwives in South Sudan. So the idea about being new into the profession is because we both groups were learning how to be a midwife at that moment. And midwives in Canada, we were supporting our peers in South Sudan with knowledge translation, sending material. Maybe Jenn can go deeper into that, but one of the biggest challenges we had, though, before the world became virtual, we were actually doing virtual work with them, and then there is a time difference as well. Well, Dora is back, so she probably could talk about it. But then we really tried as much as we could, sending information, getting in contact with them. But then through the process, we learned that there is so many challenges for our peers in South Sudan, not having reliable internet, not having access to getting into a computer, and even gender being in place. Like, I remember that most of us, we had more success getting in contact with female midwives rather than male midwife rather than female. And I learned that because of my peer is female, so she was taking care of the kids, or she couldn't walk at night because it wasn't safe for her. So all those components you really learn through the process. And I couldn't be thankful enough for the opportunity to be part of the team.
Okay. Jenn, would you like to add something?
Yeah, the knowledge translation piece of it was really, really quite interesting, because I think some people would assume like the Canadian midwife would bring knowledge to the South Sudanese midwives, but it was, I feel like, completely the opposite. I really took an interest to this program because, you know, in the hospital we have a lot of resources, but at home births we do not. And so there were so many interesting tricks and tips that I learned from my South Sudanese peers. One of the ones I can think about is a Bacri balloon. So if you're having a postpartum hemorrhage and your uterus is floppy, I don't know who is on this panel, maybe everybody knows this, but there's this device called the Bacri balloon where you place it into the uterus and it fills up to put pressure as a tamponade on the uterine wall. And one of my South Sudanese peers showed us how to do a Bacri balloon with a Foley catheter and a condom. And a Bacri balloon is like $500 for one device here, and the condom and the catheter was like, I don't know, $2.90. And just my mind, it kind of exploded, you know. It's just kind of amazing, the resources and the creativity, and you know, and our actual peers use that to save lives, and it works. So it was just I have a condom and a catheter in my own birth kit now for that reason. It was a really wonderful experience. I really enjoyed it.
So I think that Dora is back on this panel. So maybe Dora, are you? Can you speak? We were discussing the peer-to-peer experience, and I think that you were also part of it. Do you have something that you would like to share?
Also, we can thank those Canadians country like those who used to support the Sanama Nurses and Midwife Association in South Sudan, because they have been supporting us with so many things. Even they support us with training, they support us with experience, even encouraging midwives and nurses to collaborate together, to work together. This is the benefit of CAM.
And I would like maybe to also mention the fact, just in case you would like to offer a financial support to the South Sudanese Nurses and Midwives Association, that we have some fundraising initiative. So SNAMA, the South Sudanese Association, Midwifery Association, in collaboration with CAM and the registered charity, the Mercy Project, launched an income generating initiative in 2019, and that was to empower 5 chapters of SANAMA, the South Sudanese Association, to raise funds that will support their activities and their members. So each chapter has started a business within their community, and the revenue raised will help to support their midwifery work. Through this program, each chapter was trained to develop the sustainable business plan. Each chapter that will have completed successfully this process will be supported to start their own business initiative, and the materials that would be needed for these businesses will be purchased with the money that would be raised through this fundraise initiative. Alex, are you there? We'll put in the chat box the link and the information for this fundraise initiative. So I think this is it. I don't know if there's anything else that any of you would like to add.
I want to thank Dora so much for staying till now. I don't know what time is for them, but we really appreciate really our friends, or our friends and peers in South Sudan. They've been doing, like, I don't know how much they really are doing to save the lives of their people in their communities. And they're amazing in the way that they're working, because as Jenn said, like, they're seeing things that we don't see as midwives in Canada, like triplets, cardiac conditions, and they have to manage those things because they're the only ones working then. So if you have the opportunity to help them or to donate, please do. Assess their mothers, their fathers, their siblings, and their children also, and they're supporting their families as well.
All right. Any last words, Jenn?
Susana said it all. Yeah, thank you very much.
Thank you. Thank you all for being there with us, and stay tuned for another webinar. Bye.